So, dear participants, today in second session, we have invited Dr. Anish to interact with all of you. As we know that Dr. Anish is an associate professor and former head of the Department of Social Work at Rajgiri College of Social Sciences, Kerala. He also serves as Assistant Controller of Examination and head of the Strategic Pillar Advisory Council at the Hill campus. He is a registered mental health professional under the Mental Health Care Act 2017 and a research guide at Mahatma Gandhi University, Kottayam. In his role as district coordinator for the Nasha Mukt Bharat Abhiyan in Ernakulam district and project director for the Rajgiri Community-Based Action for Drug Prevention Project. Dr. Anish had spearhead significant community initiative aimed at combating substance abuse and behavioral addiction. Dr. Anish has held a number of key academic and professional positions, including chairman of the Board of Studies at Mahatma Gandhi University, Kottayam, and Rajgiri College of Social Sciences. He is also the member of Board of Studies of Shri Shankaracharya University and the 8 autonomous colleges in Kerala. He has been recognized with the major research grants and fellowship from prestigious organizations such as the Finnish National Agency for Education, the German Academic Exchange Program, the Australia-India Council, the International Association of Schools of Social Work, and the World Association of Psychosocial Rehabilitation. His research endeavors have been supported by the University Grant Commission, the Indian Council of Social Science Research, and the Ministry of Social Justice and Empowerment. He provides consultancy services to a large number of the organizations, including the NICO, NISD, NIR, DPR, NTPC, Habitat India, and Muthoot Finance. Additionally, Dr. Anish is a founding member of the Kerala Association of Professional Social Workers, and he has also served on the editorial board of the number of journals, national and international. So, with these words, we welcome you, Dr. Anish, to this very short-term course, and really, we are very much thankful to you. In spite of busy schedule, you have spared your valuable time to interact with our participant. So, we welcome you and express our gratitude and thanks for accepting our invitation. With these words, once again, I welcome you and request you to please make an interactions with our participants. Thank you. Thank you very much.
Thank you so much, Professor Naseem. Thank you for that elaborate introduction. And I'm sorry for a very long introduction. I'm really happy and proud to be here with you all today, because I got this opportunity to be with you because of the interest Professor Naseem and his team has made on me. So today, I'm aware that this is the last day of your short-term program, and you're all keen to understand what is community engagement, or you already know what community engagement is all about. So I would like to share some of my experiences working in the community with regard to substance abuse prevention. As you heard from the profile, I've been working with the Nasha Mukt Bharat Abhiyan as a National Resource Pool member, as well as I've been working in some of the projects of National Institute of Social Defense on substance abuse prevention. So I will be sharing some of my experiences to discuss with you how community engagement can be effectively utilized in the context of substance abuse prevention. I also understand that you are all from diverse fields and you have various experiences with regard to different dimensions of your field of practice. So this will be something very much related to community engagement or to the social work field. So I am really happy that you have taken up this initiative to be part of this FTP, because most of the time when people from other disciplines do not want to know much about these things. So I'm really happy that all of you are here. And as time indicates, we need to finish by 12:15. So I will speak maybe in another hour, 1 hour. Then we can take some questions or your comments or experiences need to be shared. So I would like to have a participatory audience. I know that this virtual platform can be too non-participatory or can be participatory too. So I wish all of you will be with me toward the session. And I would have loved to have a physical session, but because of our mechanisms, we'll be having more of an interactive online session. So welcome to session. So I'll start sharing my screen and we'll continue. If I go very fast anytime, anywhere, please let me know so that I can slow down. Can anyone confirm that whether my screen is visible to you?
Yeah, it's
Yes, sir.
visible.
Colorful? Colorful?
Yeah, it's colorful.
Yeah. Okay. So we'll start this colorful because online otherwise it will become very dry. That's why we'll make this colorful. Okay. Okay. So as you are aware, this topic will be on substance abuse prevention. And we know that our country is going through a big threat of substance abuse or drug issues. We know that there have been a lot of understanding that if you want to damage the society, you feed them with drugs, and that will damage the youth. We all have the great privilege of having the greater demographic dividend of having the highest number of youth population in the country. And our initiatives with regard to equipping them to be effective and contributing citizens can be in question if substance abuse is not taken care of. So now we know that the type of substances coming from various parts of the world, we are a good market because we are a large population. And some people purposefully put that to us because we want to, they want to spoil us. So in that interaction, we need to understand that we can do a lot, irrespective of your discipline. You're all working with the youth. You're all working with the youngsters in colleges. So we have seen people coming through these type of issues. So we will focus on that. So the agenda of today's session will be, I'll just give you some idea about community engagement, which you might have already gone through, but I'll just briefly touch upon that to start off my discussion. Then we discuss about what are the components of community engagement. And I will discuss my own project, which will be on this community engagement model. So I'll be discussing on that. That will be the agenda. So now, what is community engagement? You're all aware of it. I don't want to tell you this again, but it's very important to talk about this because when we talk about community engagement, we have to engage the community for a cause. So when you look at the definition, it is a process of building relationships and collaboration with community for achieving a shared goal. Now here, our shared goal is very, very clear that we have to engage the community for prevention of substances. And for any development program, this is very, very important. So this principle of practice is very important there. So what is community engagement? We work collaboratively with a group of people to address issues affecting their well-being. So anything that is done with the community, we work with them. And with them, then we will address the issues to affect the well-being of these people. Now, it is a powerful vehicle for bringing changes in the society. Behavioral changes, community improvements in the community, overall well-being of the society is being taken care of in this context. Now, we know that we mobilize resources and influence systems within the community so that we become catalysts for changing policies, programs, and practices. It's a definition of community engagement, which I don't want to teach you because it's not important. But you need to understand that we are going to work with the community to make changes in the community for some cause. So we collectively take up this as a responsibility of a person who is going to be engaged with the community to get the community participate in the process so that we are going to make long-term change in the process. I'm going to show you a brief video which will clearly talk about why community engagement, but I would take your response after showing this video. This is a very short video, 3-minute video. After that, this is not directly connected to community engagement. I want to get your feedback with regard to how this is giving idea about how community engagement is important. Okay, I'm coming to that. So please watch this video, just 3 minutes. After that, we'll come back and discuss further. Thank you. Okay, may I ask you what are the things you observed in the video, or how can we link this to community engagement, or is there any way we can link this to community engagement? What do you think? Can anyone can unmute your video and speak, or if you're comfortable, you can write in the chat box also.
In the earlier, it was shown that there are some exercises, instruments were kept, but he was not interested in doing the exercise. But later on, the moment he saw that there is an opposite gender lady is there and she is watching, so he started thinking, why should not we be try to be showing him my body that I am working out and like that.
Okay.
And suddenly, just having a look, it was nothing been said by her that she is involved into that particular thing, but just by observation, he took it in. He decided things in the mind, and he started working out. That was the scene.
Okay. Now, how can we link that to? That is a wonderful summary of the video. But how can we link that to community engagement?
Sir, can I say something?
Yes, ma'am. Yes, ma'am.
In one line, we can say that community inspires us in many ways.
Okay. Right.
It helps strengthening a relationship also. So
It helps in strengthening relationships. Yes. Appreciation. Chitranjan say, yeah, appreciation matters. Yes.
so it helps.
Everything is around us. The mindset, I believe. It is just a social mindset. Yeah.
The mindset is very, very important. Yeah. So now looking at this video, it is no way connected to community engagement. Now community is shown here, just an individual. But look at this person. This person, what was his condition before? He was not interested. He was lazy. He did not want to do anything. But when he found a purpose for doing something, what was his purpose? This girl was a purpose. He wanted to impress the girl. So when he found a purpose for him to do something, he was able to take charge and he was able to lift the highest weight he had in his room. But have you ever imagined that this fellow will do this much in the earlier time when he saw the first time? His capacity would have never felt that he would be doing this type of a thing. But when he understood there's a purpose for him to do something, he realized the importance of doing it. Then he started working on it. That's why he was able to bring his own resources. So where was the resource? The resource was within him only. It was there only, which he never realized, which he never felt why he should use it. Now in community engagement, that's the very basic philosophy. That the community should understand why we should take action. Why should I take action? And how this action can lead to change. What is the purpose of my action? So then the resources are within the community so that they can actually utilize the resources within the community and change, which we don't have to go and feed them. Rather, it is there in them. But only task for us as a facilitator is that to show them the purpose, why they should change. The purpose, the purpose is very, very clear. That is the way it has to be communicated. Now coming to our concept of community engagement. So can we apply this here? Do you agree with me? It is not very connected directly to this, but can we agree with this? Yes or no?
Yes, sir.
Yes, sir.
Can we relate? Yes. So basically, I just want to show this video to engage you in the audience. That's all. Okay. Now, so what are the characters of a good community of engagement? The first thing, foremost important thing is that inclusivity and diversity. What is inclusivity? We have to include everyone. Whether people are diverse, people are of different nature, people are of different status, doesn't matter to us. We have to be inclusive in our approach to working with the community. One of the important characters is that. Second thing is that whatever we do with the community should be transparent so that they will trust you. When you are transparent, people will start trusting you because when you are able to do things in a transparent way, it will trust you. Now, you also focus on sustainability because as a facilitator, as a social worker or a person who is engaged in a community, we are not going to be there all the time. We are going to be just leaving the place after we engage with the community. So what is important? They have to sustain. The intervention has to be long enough so that it is going to be continuing in the community even if we are not there. So any engagement process should focus on sustainability of strategic interventions. It also need to be flexible because you go with a plan with the community. Sometimes it may work well with the community. Sometimes it may not work at all. Then we have to understand what works well with the community so that we can be responsive to the needs and priorities of the community so that we can engage with the community effectively. We are able to be responsive to the needs and priorities and situations of the community. So we see the community in context. We don't go with a textbook knowledge. We go to the community, understand the community. We work with the community in a flexible mode because of that. So, and very importantly, we collaborate. The word is collaboration. In our research, as all of faculty members, we know that nowadays it's a world of collaboration. Alone, you cannot do many things. You want to publish, then you have to do collectively with some work with someone so that we can able to produce outcomes. So shared power is very important. Somebody was telling me these days, empowerment. The word empowerment, the power is more important. Whether you have the power to control your life, then you're empowered. The community need to be empowered. That means the power is shared with them. It is not top to bottom approach. Rather, we are going to work with them in a collective manner. So this is the basic characters of community engagement. Now, some of the core values of community engagement. Sorry for going on a very lectural model. But if you have any confusion, if any clarification or any questions or any comments, you can raise at any point of time. Now I'm sharing the screen, so I'm not able to see you all. But if you just unmute your mic and start speaking, tell me that I want to speak. You're always free to do that. Okay. Now, what are the core values of community engagement? The first and foremost value is that those who are affected by a decision have a right to be involved. If you are working with a community, you're working with students, if you're working with youth, you're working with the tribal community, if you're working with the marginalized communities, if you're working with the fishermen, they have a stake in the decision-making process. It's not somebody who will just go and give our information and ask them to do all this. No, we will help them. That's the beauty of community engagement. When you engage the community, we give them opportunity for the participant to be part of the decision-making process. That's very, very important value. So that we are not the expert. We are not just the expert. We are facilitators. Second thing is that the public's contribution will influence the decision. The decisions is ultimately influenced by the contributions and suggestions and ideas of the people who are there. It promotes sustainable decisions by recognizing, communicating the needs and interests of all participants, including decision makers. We have multiple stakeholders. We're going to work with them. So it promotes sustainable decision making. Very, very important. Again, involve people. It seeks out and facilitates the involvement of those potentially affected or who are interested in the decision, as we mentioned the first point. So we will provide information to them so that they are able to participate with clear intention and clearly, so that they are able to meaningfully contribute to the process. So in a community engagement process, participation of community is very, very, very important. It's the key. Not only involvement in the activities, but also in the process of developing the ideas. Now, what are the approaches of community engagement? So before I go to my presentation of the model of community engagement in recognition, I just want to touch upon these theories. I'm sure that you might have been hearing about the same thing again and again from various resource persons in the last couple of days. But just to frame my thought, I'm just putting it down like this. The first level of, that is the lowest level of community engagement, is known as community-oriented approach, where we will inform participants, we will tell them what to do, and they will just do. So we do a community-oriented approach. That is a very basic level of community engagement. The second level is called community-based, where again, you will understand the community, develop ideas, but you will involve in the process of the work, but not in the decision-making. So it's community-based. Then the next one is called community-managed, where community is going to manage the process. You are just observer, you are just facilitator, you just provide a leadership, and community will manage. Community-based organizations are there. For example, I remember I've been working with HIV sector for quite a long time. In the HIV sector, initially, all the HIV prevention programs were managed by the professionals who are staff in the project activities, and they were doing that. And gradually, we developed community-based organizations for sex workers. For example, there are community-based organizations for sex workers because we largely work with sex workers to prevent HIV among them. So, HIV prevention done through, so they were managing. So, their community-based organization were their organization, they were managing the organization. That means the project director is a sex worker who is managing the organization. That means they have a better stake in the whole process. And the highest level is called community-owned. Community-own it. Yes, this is something we have to take it up. No one else is required to come and tell us to do this. We are owning it. They are owning it. That's the highest level of community engagement. So the lowest level is community-oriented level. Community-based is next level. Next is community-managed. But much more than that, community ownership is very, very crucial, which is not very easy to happen. But certain things will happen like that. For example, you are aware of programs like the livelihood programs or programs which are mainly meant for people to have their basic livelihood. Those programs actually are community owned because they have to live, they have to manage the whole process. Now, there are which levels. The first level is called informing. You give them information. That's the lowest level again. Second level is you consult the community. Ask them what you want to do. That's the next level. And the third level is involve them. Be them, take them part of your process. Involve them. Next level is called collaboration. You collaborate with them, collaborate with them. And the next level is empowering. So you empower them. So at this point of time, I would like to share one story with you. We know that there was a rural village. There was a rural village. And this village was largely depending on agriculture for their livelihood. You know that most of the villages in our country, farming is a major activity. They depend on farming as a major earning means of earning, and they were living with that. Now, there was once there was a problem in the community where one person from the field came back and told the villagers that there was a big monster in the field. There was a big monster in the field. So when they heard that there was a monster in the field, they were all afraid. You know that definitely people are afraid when there's a monster. They were all afraid of monster. Then they started, the news spread very fast because in a community, this word by mouth, it's communicated very fast. They were all very afraid of the monster. Suddenly what happened? They are afraid, so they stopped going to the field. They stopped going to the field. So when they stopped going to the field, what happens? Their income source is stopped now. They had few food items left with them, so they were able to manage with that food items. But gradually, they were starving because the food items got depleted. They did not have enough food items to take care of their life. So when they had difficulty taking care of their life, then what happened? They had starving. Then they were seeking support of people how to manage this. One day, a very expert, a person supposed to be an expert, went to the community. He wanted to see what is happening with the community. What is the problem with the community? So he wanted to see what was the monster. So I'll just show you the monster here. Just share the monster. So they were all keen to the expert was keen to understand what the monster was so that he was able to help it. So suddenly he went to the field and tried to identify what is the monster. So he found that villagers were standing like this. The monster was this. Was the monster? This was the monster. So the expert felt, what foolish thing. You also might have thought, no, how they should be fearful about a watermelon. So the expert understood that it's a watermelon. What is this? No problem. He told them, yes, I know. I understood the problem. I will manage it. Don't worry. He just went to the field and cut it to pieces and started eating it, showing them that he started eating the monster. Suddenly, people understood, see, this fellow is capable of killing the monster and eating it. So he is more dangerous than the monster. So immediately what happened? They were afraid of the monster, but they were not afraid of a human being. Then what happened? They took up all their weapons and killed the experts. Now the second person went. He asked them, what's the problem? What happens? What happened? They said, there's a monster on field. There's a monster in our field. We are not able to go to the field. We are not able to take our yield. We are not able to eat. Our life is in trouble. Oh, he empathized with them. Okay, so I understand that you're going through big trouble. What can we do about it? And people said, we have to get rid of this monster. Otherwise, what will we do? Okay, you want to get rid of this monster. What can we do about it? We have to fight it out. Okay, he asked again, okay, how shall we go about it? They said, we are afraid, we cannot go. How can we do about it? And he said, we have to manage it. How can we do about it? Then some of the young people who are energetic said, if you are there to lead us, we will be there to help you. And he took the lead. He took them forward. He went close to the watermelon. He also understood it is just a watermelon, nothing else. He understood. He just went closer to the watermelon and asked them, shall I touch it? No, don't touch it. It's a monster. Then he slowly, no, let us see. He slowly touched the monster. Nothing happened. So he said, if you want to try, ask them to try. They were all trying. Then nothing happened. can I knock on it? He knocked on it, broke it. Nothing happened. People were happy. Nothing happened. They were also part of the process. Then he distributed this to them. All of them had one piece of it. They enjoyed food of. So he said, okay, this is beautiful. This black thing in the seed, you just keep the seed. We can cultivate next time. And he told them, this was not a monster. This was just a big watermelon. Then they were happy. They were helped. So, just a minute, please. I'm sorry, there was an interference. The flow gone. Are you all with me? Yes or no?
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
So now,
Yes, sir.
which approach was good? The first person's approach or second person's approach?
The second approach, sir.
Definitely the second person's approach. We all know that because it's very, very clear. So what was the difference in the approach?
So in the second
first
approach, the
person-
person took the
Yeah.
community in confidence and get them work together.
Yes. And the first approach?
It was a one-man work kind of a show.
Yeah. So the first person took a expert position. Yes, I know it. You are just silly people. You're silly people. You don't know this. I know it. So I can do it. I can help you. So that approach of a superiority approach may not work in a community setting. Because community has their knowledge. They have their resources. They have their understanding of situations. They have their cultural understanding. So we have to be going along with the community. Engagement is very, very important. The second approach was a community engagement approach. If you took the community along with you, you helped them to participate in the process. The process was liked by them. So basically, community engagement makes lot of impact in the development of the community. So an engaging approach is very, very important. So basically, what I was trying to tell is that we may be knowing these things. As experts with having knowledge, better knowledge, we may be knowing many things. But it's very important, how do we take them from a higher level? So we understood the values, we understood the approaches, we understood what things. So consultation is very important. The second approach, we found him consulting the community, asking them what they want to do, involving them, taking them along with him, collaborating with them, and empowering them, telling that this is not nothing to be fearful, but you can use the seed to cultivate for other harvest, an additional income for them. So empowerment happened. So approach is very, very important when we work with the community. Sometimes we may be knowing everything. Sometimes it's very fast to do. For example, when we feed our children, what is easy? Making them to eat or feeding them? Which is easy? What is easy for us? Making our children to eat by themselves or feeding them? Which is easy? Most often, feeding is easy because they don't spill out, because we can save time, you can make it fast. All those things are there. But will the child learn the skill of doing it? They will never learn. So when we are making our children dependent on us, we are actually spoiling them rather than helping them. So for a community approach also, that's very, very important. We have to keep them along with us so that we are able to do that. So basically, we understood these are the principles. Now, what are the components? When you want to work with a community, one of the most important things is stakeholder mapping. Who are the stakeholders in this particular aspect? Now you want to do an NSS camp, National Service Scheme camp in a community. We have to understand who will be involved in this process so that who can help us in the process. So it's stakeholder mapping. Who are the people involved in the whole process? We have to map them and build relationship with them. We talk about that in the coming slide. Then once we understand the stakeholder who are going to be involved in the process, we need to enhance their capacity. The capacity building is very important so that we are able to build the capacity. Then empowering them to take action so that we are just facilitators, but the community will take lead. Then we have to have community-led planning and decision making. Again, They have to lead. Okay, these are our needs. We have to work on it. We have to work on it. What we can do about it? They have to take decisions. That will help them to go about it. Then we have to have feedback mechanisms. Whether are the community going together? Are there splits and conflicts in the community process? We have to understand as facilitators, develop feedback mechanisms. And we also need to evaluate the process so that we have to reflect on whether our effort was helpful, how much it was helpful, what was the effort, how much it was effective. All those things can be the components. Now, I would like you to just open your cameras or your QR card scanner and just take click on this link. Okay, I will do one thing. You can actually scan this QR code or click on this link. I'm going to put that in your chat box. Click on the link, and we are going to now work on community-based drug prevention. So you can just suggest to me who are the stakeholders to be considered. Now we are going to engage the community for drug prevention. Okay, we are going to engage with the community for drug prevention. Just click on the link, and it will it should directly take you to the questions. The only one question is there. Who are the stakeholders? Write your three, one or two, three. You can write up to three. Just three names of people. You can be in Hindi also. You can write in English also. You can write in whatever language you are comfortable. You can write that. So write who are the stakeholders in drug prevention in a community. Now we are going to initiate a program in a community. So who are the stakeholders of drug prevention in a community? Please click on that and answer to this. You can click just two, three questions. Okay. I will share the responses. Your names will not be visible. You can just write as much as possible. I will share the Did I leave the meeting in between? Accidentally, when I was closing some files, I might have closed the Google Meet also. Okay, I got around 4 responses. He said law and order, friends, family and society, parents, government mechanisms. Fine, fantastic. So I can see 7 people's response. So basically, many of it all society. Society is one of the very, very important part of it. Parents, NGOs, government mechanisms, government agencies, community organizations. doctors, media, social influencers, all are stakeholders. So if you want to make changes in society in terms of these things, we have to definitely have the society involved in the whole process. So now who are the stakeholders in it? So now you look at these things. Some of the community stakeholders are who are they? Parents and family members. People recovery already who have been troubled with substance abuse, they recovered. Places like barber shops, saloons, gyms, because there are people, youth coming in. So you can transmit information through them through these type of mechanisms. Media, schools and education institutions, youth organizations, civic and volunteer organizations, health personnel, local self-governments. So we can work with any sector to work with a community setting. So basically for community engagement, we have to first identify who are the stakeholders for our cause. So now I am going to talk about our cause is substance abuse. So basically when we talk about prevention of substance abuse, this theory is very, very important. So basically we talk about primordial prevention. That's the lowest level of prevention, where what happens is we have to work with the larger society. Basically, we can work with the government, the policies. For example, there is a policy in Kerala where people cannot smoke in public places. If they're smoking in public places, they'll be caught by the police. They'll be fined. That means that's a policy which is influencing people's use of substance in a public place. Now, there is a rule that there should not be substance selling centers 100 or 200 meters closer to any school. That means that's a policy, government policy that is influencing substance abuse prevention. When we go to theaters, you see that first the thing about substance users, tobacco use and other things in the screen, because that's a policy, government policy that every theater should show this thing before they start a movie. That is known as primordial prevention. That means in a community level, we do in a very, very wider level where policy level decisions are taken and those are done. Now the primary prevention is people who are at risk, we have to save them from substance abuse. That is the primary prevention. That means before occurrence of the problem, we have to take into consideration of their risk and they have to be helped. That is all youth, all children, all people who should be prevented from starting substance use rather than helping them to work with substance use after they start it. That's primary prevention. Secondary prevention is where we talk about early identification and treatment. That means you identify the problem early. So somebody has started using substances, identify them early so that they can be helped easily and faster so that they don't go to the trap of substance abuse. And tertiary prevention is where you help work with people who are already addicted, but they have to be helped to come back. They are treated, they are helped to come back. That's the tertiary prevention. This is a theory I am using in my project with regard to substance abuse prevention. Am I getting across to you? Am I clear to you? Am I going too fast? Please let me know.
No, sir.
Okay,
No, sir,
perfect.
it's clear.
Perfect. Okay, perfect. So this is a theory I'm going to use. These are known as the levels of prevention theory. I'm going to use in my project. How I'm going to use community engagement for my project with regard to substance abuse prevention. Okay. Now this is the Government of India mechanism. It's known as the Ministry of Social Justice and Empowerment. You know that the Ministry of Social Justice and Empowerment has a mechanism to prevent substance abuse in our country. Now this is the green part. This green part is actually the Nasha Mukta Bharat Abhiyan program, where we generate awareness about substance abuses. You develop capacity society to identify issues and things like that. Develops community resources where people are aware of these things and they can disseminate information to community. That is a capacity building prevention part. Then there are people who are at risk. I told you secondary prevention. For secondary prevention people, they have two projects called ODIC and CPLI. ODIC stands for Outreach and Drop-in Center, which is actually a project for identifying early users of substances, and they are given community-based counseling and services so that they don't fall into trap of substance abuse. Similarly, there's a second project called CPLI, which is focusing on community-based peer-linked intervention. It's known as community-based peer-linked intervention, which is actually meant for using peer group members to facilitate behavior change in community. Especially when you work in a workplace, use peer group members to make changes in substance use behaviors. Or else you develop peer ambassadors who will help people to identify substance use behaviors and help them to come out of it. We know that large majority of substance use are developing because of peer influence. So community-based peer-linked intervention focus on reducing that or using those peer influence for a positive change for people to get out of the problem. Then next is called IRCA. It's known as Integral Rehabilitation Center for Addicts, which is actually meant for treatment of people who are already addicted. So that there are centers funded by the government of India across the country so that people can take free treatment for substance abuse, any substances. That's funded by the government of India, which is known as IRCA. That is already, people are already started using it. They cannot live without that. They need to be treated because addiction is a disease. Addiction is a disease that is to be treated. So that requires a treatment center. All these three things, capacity building, awareness generation, ODAC, CPLA, are all meant for community-based action. But IRC is a treatment center they have to treat in the hospital system. And there are other treatment centers in the hospitals, they are in the next level. So this is the framework of intervention. Now, so how do we do? When we gather the community, community-led implementation is done. We refine the ideas based on the community's understanding. The results are disseminated to community. The community's capacity is built. Then the practice is done by the community. Then the outcomes are going to be better. Now, I'll just talk about some of the principles. Are you getting bored?
No, sir. No.
Okay,
Yes,
okay.
yes.
Because
There's
since
no
I'm not
board.
able to see your face, as teachers, you know that. We always take
Yeah.
feedback from our students, no? Their
Yeah.
facial expressions. That will tell us whether they are listening or not. Okay, thank you so much. Principles. So what are the principles? There is always an element of mutual respect and understanding. You understand from the story. That person who was a second person who was actually showing respect to them, asking them what they can do about it, what they want to do. So that there is a mutual respect and understanding of the community. Second thing is that there is equity and inclusion. We need to include people. There need to be not inclusive. A lot of inclusive practices has to be there. Not just equality. Equity means somebody who is vulnerable need to be given more opportunity so that they come to the common level in the same level. Equity is very important. Then transparency and accountability. Whatever we do in a community, we have to be transparent so that we have to be accountable to the people. Shared goals and co-design. The goals are very, very important. That goals are shared. That means it is not our goal, it is the goal of the community. We are sharing the goal with the community. Yes, our community should be free from drugs. Our children should not fall in the trap of drugs and alcohol. Our family should be happy life so that there is no domestic violence because there is no alcohol use in the families, substance abuse in the family. There's a shared goal. The community share the goal. And we co-design. We design the intervention with them. Co-designing is very important. Then we focus on sustainability and continuity. So our principle of practice is sustainability and continuity. Now, a small task for you. Those are with me. Tell me how many squares are there in front of you. Just tell me how many squares. You can
16.
16. Okay. Now it's an auction. So anybody who can tell more than that, I will appreciate. 16 is agreed.
It's more than that, sir. It's
Huh?
more than 16, 4, 20, and
20. Okay. Good.
21, sir.
21,
21, sir.
21. Okay.
20, 22, sir.
बहुत सारे हो जाएंगे
22.
बहुत सारे होंगे
Yeah.
Or more.
बहुत सारे हो जाएंगे और ज्यादा
Okay, sir.
24. Now what are you asking?
25, sir.
25. Anyone more? More than
23,
that?
sir. 23.
No, now we have reached 25 marks. So we will not come back. 28.
23.
28. We come 28 now. 28. Good, good. 28. Now,
I have said only 23, sir.
you are seeing only 23.
ये तो मैथमेटिकल एक वो एक रीजनिंग वाला क्वेश्चन हो जाएगा इसको लगाना
Yes,
पड़ता है
yes. I will come back to that later. Okay, sir. That's wonderful. Perfect, sir. Good. So 28 is the largest number. I will say 30. Okay. As sir said, there's a formula for this. It's actually n square plus n minus 1 square plus n minus 2 square until 0. Okay. So here n is 4. So n square is 16. 4 square is 16. Now n minus 1 is 3. 3 square is 9. That is 16 plus 9, 25. Now n minus 2 is 2. 2 square is 4. So 25 plus 4, 29. Then n minus 3 is 1. That means 1 square is 1, 29 plus 1, 30. And n minus 4 is 0. So there is no square. So now 30. So basically, if you look at here, see what is this? I'll just show you. Okay. All this outer score is 1. You all agree? 1. Then 16, you already told, 17. Agree. Now 2, this one. 18, 19, middle one, 20, this one 21, this one 22, this one 23, this one 24, this one 25. Now take 3, 26, 27, 28, 29, and middle square we don't count, so 30. That means when we look at anything in community, usually we see the what is obvious. Usually we see the what is obvious. What is obvious here? It is 16. 4 into 4, 16. That's very common sensical. But when we look into that in detail, you are able to see 21, 23, 24, 25, 28, 29, 30. Now, if you are skilled enough, you know the mathematical formula for this. You are on a bit of a second, you are able to calculate, okay, 4 square plus 3 square plus 2 square plus 1 square, you got the score. That means when you are an expert in community engagement, you are able to understand the community very easily. But when you are learning, when you have to look at thoroughly so that you understand the community better. So basically, that's what I wanted to communicate, and I wanted to have your attention also with me. That's why I brought in this particular activity for you. Okay. Now we are moving to my project. That is called Rajagiri Community-Based Action for Drug Prevention. It is funded by the Ministry of Social Justice and Empowerment under the Nashamu Abhiyan. And they have asked us to identify 2 municipalities, local self-governments, and identify 10 villages so that we can work with 10 villages on drug prevention. So we call it Rajagiri. It's called R Combat, Rajagiri Community-Based Action for Drug Prevention. This is 2 municipalities we have taken for this project, and we have done almost completing this December 17th, the last day of this project. We're going to complete that soon. So this is actually the Government of India under the National Action Plan for Drug Demand Reduction. It's called NAPDDR. There was a study by All India Institute of Medical Sciences in 2018, and that study identified 272 districts in the country as most vulnerable districts in the country for substance abuse. So unfortunately, one of the district was the district where I'm living now, that's Ernakulam, that's Kochi. You are familiar with Kochi, one of the major cities in Kerala, Kochi. In this city, this district is identified one of the riskiest districts. That's why government asked me, because I've been involved with them for many other activities, the training of ODIC, CPLI, and different people in the ministry. They asked me whether I could take up one project through the education institutions. Then we selected 10 municipal wards, villages in the municipality. Then we started working with them with some of those things. Now I'll talk about a project. This was a model. So I will just show you. This is very little, so many things on one slide, but just to see that our first task was to identify the communities. So what we did was, myself and along with one of my co-project director, we went to the 2 municipal councils. So we went and met the municipal chairperson into these 2 municipalities. And we asked them whether we will be able to attend one of their council meetings. And they welcomed us to the council meetings. So we went to the council meetings of these 2 municipalities, and we talked to them about the projects we want to implement. It's about substance abuse prevention. So as we know that every community has this problem, and they were all very keen and happy that this is actually going to happen. So we discussed with them about the project, and the community leaders, that is the ward councillors who are there, supposed to be taking care of these type of affairs. So the standing committee chairperson of the welfare activity, standing committee chairperson of the health activity, standing committee chairperson of the education activity, they were all there in the ward municipal council meeting. So they were ready to take it up. Then we asked them what we can do about it. Then 2 municipalities. Then we organized a meeting in our institution, the college where I'm teaching. We brought them, all of them together, 2 municipalities, and brought them together. All council members came together. We did a training program about response to substance abuse, or importance of community engagement in substance abuse prevention. So then we identified them, and we identified 10 villages from this whole municipalities. So the municipal council members of these 10 villages were partners or leaders in the whole projects. When they were coming together, then we are actually wanted to, because the council leaders are having other responsibilities, they will not be able to take up these responsibilities. Then we went to the next aspect. We wanted to develop some community committees. So then we asked the ward councillors who all will be interested in taking care of this activity. So we identified stakeholders. We tried to identify stakeholders in the community. Then they said, okay, ASHA workers. They said Anganwadi workers. They said school teachers. They said youth welfare organization people. They said excise officials. They said police people. They said the staff members in the major health the sub center or the community health center, those type of people. So we identified all those people as a community committee. We formulated a committee in every ward, every council, every village, a committee in the village. We had a first meeting with them and we trained them about substance abuse, about the need for prevention, the possibility of prevention, what can be done in a community for prevention. That's we were informing them. Again, they took up responsibilities. We had series of training programs for ASHA workers in the community, all ASHA workers, through the National Health Mission. We trained all the Anganwadi workers in the location, Anganwadi workers and the helpers in the location, and trained them about substance abuse basic damages. We developed education materials for them, prepared materials for them, and developed materials for them. And we also identified some people as our Nasha Mukta Abhiyan executives, means who are our community link persons. They are our link in the community who will take up initiatives. Then once we did that, we started campaigning. Before campaigning, what we did was, we did something called resource mapping. We did resource mapping. So we went to the community, along with the community members, with the support of the community executives, with the support of the ward councillors, we went to the community and developed something called the mapping here. We have been in development projects, we do resource mapping. But here, we try to identify the community, the location of the community, and hotspots in the community where drugs are being used. This is one of the models of one of the wards here. So the red mark here indicates that this is a forest area, barren land where people are not very much there, but this region is actually used by drug users for drug use. There are some locations here. Here, these red marks are the places where this ward people often use drugs. So we identified them, the roads are marked, we identified them so that with the help of the community members, we try to understand where does the problem lie. Then we do something called a vulnerability mapping. This is the mapping process we did. Okay, it's called a social mapping process. This is actually a model taken from the National Institute of Social Defense Mechanisms. Then we did something called the vulnerability mapping. So we identified the key stakeholders. We identified key stakeholders and went to the community and talked to them about with a questionnaire. It's an interview gate. It's not a questionnaire, an interview gate. We asked them about demographic characters of the community, employment status of the community, substance use, presence, prevalence, type of substances used. From the key persons in the community, we interviewed them, try to understand what are the type of substances used, where do they use, when do they use. There were a lot of migrant communities in this location because this is an industrial area. These two municipal councils are industrial areas, so a lot of community districts are there. We try to look at how much available is drugs and alcohol, what type of drugs are generally available, where do people use things, and what is the number of people they think they are using drugs in the locality, and what are the factors influencing drug use, types of drug use. Likewise, what is the impact of drug use on individuals, families, and community. Likewise, we asked a series of questions to them so that we developed a summary of what is the nature of problem in this community. So now, see, we started with the municipal council, the key persons. We had interaction with them, we educated them, we took them with us. Then we went to the community, identified other key stakeholders who can be part of the whole process of community engagement. So we identified ASHA workers, identified Anganwadi workers, identified school teachers, identified school sports teachers, identified gyms where the gym is happening, identified Anganwadis where this youth are coming, youth clubs where there. So we have tried to identify community executives, train them again. We had fund for that, very clearly fund for that, train them. Then we actually involved them in the process. Then we went to the community, the key persons, and asked them about this big interview gate And one of the good thing was that we used our volunteers for doing that. Volunteers, basically our students, social work students were engaged. They were trained to do this. They went to the community and engaged with the community, understood how their the situation. Then based on that, we developed a plan. How many awareness classes should be done? How many interactive sessions should be done? How many, what is that? Umesh sir, I'm coming to you. Okay. I would love to hear from you. Then you develop a plan. Okay, Umesh sir. Over to you, sir. बोलो सर. आप हाथ राइज किया है इसलिए मैंने पूछा. उमेश सर एक्चुअली राइज हुआ हाथ. ठीक है, नहीं तो आप बोल सकता है कहीं. Okay, so basically, so this was the process. So when do that, we actually had lot of support from the community as well as resistances, because some of the people who were actively engaging with us, when we are actively doing a lot of programs in the community, very need basis, then what happened was the drug peddlers or people who are actually distributing drugs become very much alert. They start threatening people in the community. The Anganwadi worker, I know that at least 3 of them backed out. They just backed because they were afraid that drug people were trying to make them afraid of this thing. This is a question we asked. So then we had troubles with them. So the Anganwadi workers were not ready to work with us because they were afraid of the drug peddlers. So when that, we found that's an impact of our intervention. Because once we start doing that seriously, they understood that there is a demand going to be reduced. They are going to have problem with their sales. That's why they were threatening the people in the community. But we were able to manage that with further volunteers. We involved political parties because you know that political parties are influenced in the community. We involved political party leaders. So they were able to support in the process, and we were able to go along with that. Now, this is the picture representing the summary of my project. So it had a initiation phase, implementation phase, and a sustainability phase. Okay. So initiation phase, as I mentioned earlier, we identified partnership communities 10. We prepared 10 community committees. We developed 10 executives from each community committee. So we had 100 executives trained by us, identified, trained by us, who can deliver service in the community. Then we also had training program for all of them. Then we mapped the vulnerability, risk and protective factors were mapped. Then we identified resources in the community. We developed resources, prepared education materials, developed our strategy based on discussion with the community members. Then we prepared our IEC materials, short videos, posters, leaflets. Then we had Kudumbasri. Kudumbasri is a women empowerment organization in Kerala, which is a very active forum for women empowerment. They are in all the communities. So that is one of the major sources for us to reach to communities, Kudumbasri units. Women groups. We were able to reach to mothers. We were able to teach the mothers how can we identify such changes in your own children. What are the warning signs you need to look forward in children so that you are able to identify them? Secondary prevention, early identification. We taught teachers how to identify vulnerable children, how to identify children who are risky to develop substance use, how to identify children who are started using it. What are the behavioral indicators? So we educated teachers, educated parents about that. Then we identified ASHA workers, Anganwadi workers, then awareness generation campaigns, competitions were held in schools and colleges, radio programs were done, FM radio, street plays were conducted in locations, 20 flash mobs conducted, vehicle rally was conducted, mobile. We actually developed a mobile, not a mobile app, it's a web form where people could, if they, after awareness program, if they think that they are risky to substance use, they can go and assess their risk and see whether they are risky or not, how risky they are. And in that web form, once they fill, they get a score. And based on the score, we give them feedback. And we also give them where to contact for services. If they want to take service of a mental health professional or a treatment center or ODIC, CPLI or such centers, then they can actually get services from there. Their address, phone numbers or centers are given in the web form. So after awareness class, they are not going to sit idly. If they feel they are risky, they can go and assess there. We'll share the link with them. They share the link, assess them, then they can identify the information about where they can seek services so that they can seek service. Likewise, we have linkage with the alcohol anonymous groups, narcotic anonymous groups, and things like that. Then the sustainability phase, we are in the process of declaring the community. We know that it's not cannot be declared drug free, but at least some vulnerability factors are addressed. We are declaring the community as drug-free, establishing community structures. We have, even if we exit, there is all ward members are aware of these things. Community executives are available, ASHA workers are available, Anganwadi workers are available. They are all trained to do this activity, even if our project is not there. So they are able to take up this community initiative. It's going to continue in the community. And we are actually preparing some guidelines of how to use field work or social work program, how to use NCC can be utilized for promotion activity, how NSS can be used, all can be done. We are developing some documents on that. We have done some state level consultation for that. We are going to do a national consultation in the immediate future. Based on that, we are going to develop some guidelines that is going to be document available for people to take up these type of initiatives. These are the learning we had from this project. This was the basic. So we had all these community initiatives. So we also had clearly focused on how a replicable community action plan for prevention and early identification can be developed, where we can community committees have been developed, and some of the executives have been identified so that they are able to help people. Mothers' capacity is enhanced. They are able to identify people. Teachers' capacity has been developed for identifying drug use and things like that. And prevention interventions are going to happen in the community. We are actually developing a guideline, developed a guideline for intervention for prevention, social work during the field work activities, because social work has large content of field work activities. So how we can sufficiently engage these things. If you look at this community engagement process from the beginning, from the identification of resources, mapping, working with community to develop resources, implementing those things are exactly the method of social work called community organization. So community organization is big. So we can looking at that. And how NCC cadets and NS volunteers can do this, involved in the prevention activities. Then how this web portal can help in the process. These are the major things. I have completed my session. As I committed to you, I will finish at 12 o'clock. You have 15 minutes time for questions and comments from your side. Any comments and questions are always welcome. This is my contact. If any one of you want to talk to me, interact with me, I'm available. You can email me or WhatsApp me this number, or else you can find me on LinkedIn so we can connect and continue this conversation. Okay, because I believe in sustainability and follow. That's why I'm sharing my contact. If anyone of you interested in further discussion of these things, we can definitely contact. If you're not interested, please don't take it up. Take it just for those who are interested. Thank you so much. Thank you so much for your patient listening. I hope you are engaged and you are responding to my questions. Thank you so much. Now your time, 15 minutes time is for you. Your comments, questions. Thank you for appreciation. Thank you. Ma'am.
Thank you, sir.
Thank you,
sir.
Thank you, sir. Yes.
Thank you, sir.
Completely to the point, and I would say complete engagement. The topic, as it was there, social engagement. So totally, you have engaged us in the lecture. I
you
was
so much.
feeling like I was there continuously with you, with
Okay.
having all one-to-one, whatever examples you have given to
Oh.
us.
That's so wonderful, ma'am. So thankful
Thank
for
you,
it.
sir.
This is
Thank you.
great.
It's absolutely
Speaking,
true,
ma'am.
sir. I totally agree with ma'am.
Yeah, ma'am.
Thank you, sir.
So it was
Thank
really an engaging session. Thank you very much.
Thank you so much,
Thank you,
sir.
sir.
Thank you. Thank you, ma'am.
Tahir, please. Okay. So thanks, Dr. Anish K.R. and Professor Naseem Ahmad Khan, sir, and Director UGC MMTTC, Dr. Faiza Abbasi, and dear participants. First and foremost, I'd like to extend my heartfelt gratitude to Dr. Anish K.R. for your exceptional lecture on community engagement for drug prevention. Your insights and expertise on this critical issue have not only educated us, but also inspired us to take meaningful action within our communities. Thank you for shedding light on the importance of collaboration and proactive engagements in combating drug-related challenges. So once again, thank you, Dr. Anish, for your invaluable contribution and for sharing your knowledge with us. So thank you very much. Thank you all. So now,
Thank you so much, sir.
okay, thank you. So Dr. Anish, you can leave. now. And
Thank you all. Thank you all. Thank you so much. Thank you so much.
okay, thank you, Dr. Anish.
Prasanna Sim, thank you.
It is very enlightening to all the participants. I do think that in future too, we will request you for such types of the engagements. So, dear
Sure.
participants, we are taking the leave now. Thank you. Thank you very much.
Thank you so much.
सर वो लिंक नहीं डाला गूगल क्लासरूम में वो वीडियो की
Video.
वीडियो
that-
अपलोड करना है ना
That video I can share, sir. Okay.
ओके थैंक्स सर
Yeah.
थैंक्स सर
Thank you, sir.
ओके
Thank you, sir.
Thank you, sir. Thank you very much.
Thank you, sir.